Coming up today, rising cancer rates in younger adults. How one young man is facing a stage 4 diagnosis after being diagnosed at age 27. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. No one knows exactly why, but colorectal cancer rates are rising among younger adults. What used to be considered an older person's disease is showing up more often in 40-somethings, 30-somethings, and even people in their 20s. Today, we meet a man undergoing treatment right now, diagnosed at just 27. We'll hear about the symptoms that started years ago and how he's keeping his head straight while facing a stage 4 diagnosis. And we'll ask an expert surgeon what he's seen among his patients. But first, let's get to our morning rounds today. Joining us today is Dr. Dhaval Bhavsar. He is a burn surgeon with the Burnett Burn Center here at the University of Kansas Health System. And this week is National Burn Awareness Week. Dr. Bhavsar, always good to see you. How are you?
Doing very well. Thank you. Thank you for the opportunity.
Yes. Well, this year the focus is on burn risks inside the home. So put this into perspective. What poses the greatest risks? Is it in the kitchen, the bathroom, the bedrooms? We have some advice, but where in the home is the biggest risk? I mean, one might think the kitchen.
I mean, everywhere there is either fire or flame or heat. These are all the places where people have potentially got burned. Like if you think of a stove in kitchen, oven in the kitchen, starting a grill just outside, or using kind of your fireplace at the start of the season. All these reasons we have seen people get kind of burned.
So we have advice from the American Burn Association, and I want to go through these with you. They remind people to use a timer while cooking.
Yes, it is extremely important. People forget that they have the stove on, they have oven on, they kind of put stuff in, forget to kind of turn it off, and then fire goes off. Just recently, like last week, we had in our area the apartment fire that led to kind of loss of an entire family, and most probably that was related to forgetting that the stove was on.
People always think of these as, no-brainers, but this is why you're in business, and we want to remind people at any cost of these important tips. Another one was monitor your hot water heater, set it lower to prevent burns, especially important for families with kids, right?
And correct. Like we see every year quite a few burns from having hot water kind of causing the scalp burns. More so in kids, but don't forget that elderly patients have exactly the same issue with thinner skin. And when the temperature is set anywhere at 130 and above, it leads to burn within few seconds.
Dr. Bhavsar, I have my space heaters revved up this time of year, and they keep me up at night. Did I turn them off? Do I have them down? Did I turn them off when I went to work? What do we need to keep in mind when it comes to space heaters?
Anything close to kind of space heater within the few feet distance can lead to burn or the fire and then eventually the burn. Space heaters are much worse for patients who have already got some problem with normal sensation, like patients who have diabetes, neuropathy, or neuropathy unrelated diabetes. Those patients we see every single year that they don't have a sensation, that they just have the space heater on for hours at a time and only realize next day morning that they already have burn.
Limit cords, don't overload those outlets, right?
Absolutely. Again, that the overload leads to kind of sparks and fire and everything around us in home. Most of that is man-made fiber from petroleum related, and that can catch fire very easily. And that's the reason, again, make sure that we have set up in a way that it doesn't lead to those kind of risks.
I love my candles. How do we remember to blow those out? That's so important.
As I talked about the stove, that same thing, like candle that goes on forever, eventually can lead to kind of fires. We see, again, quite a few house fires every year. And what I don't want to forget is prevention starts at home, and prevention has led to much more kind of improvement. Like we used to say that there were about 2 million burn injuries at early 90s to now 30 years after, burn injuries are about 750,000 a year. Still a lot. So we want to continue to do as much as prevention as possible.
Again, Dr. Bhavsar, most of these pretty obvious, as we know, but unfortunately, these reminders are still needed. When should people seek help or treatment and come see you?
A burn that is more than, say, size of your palm, always seek help. Burn that looks really pale, no pain, seek help. If you have other associated medical problems, please at least see your primary care doctor. A burn is more than your kind of arm length. Absolutely. Please seek help.
Dr. Bhavsar, thanks for your expert advice this morning.
Thank you.
Data from the American Cancer Society shows that overall colorectal cancer rates are actually dropping, but not for people under the age of 50. These 20-year charts show a serious drop in cases for people ages 65 and older. Rates have also dropped for people ages 50 to 64, but over the same time frame, rates have been creeping up for adults younger than 50. I recently sat down with a young man diagnosed with stage 4 colon cancer at age 27. He says that he refuses to become just another number, just another case. He wants his story to reach others now, and he is not stopping until it does. When Jackson and Hannah Layton said, "I do," it was forever, through sickness and in health. They had no idea that within months, they would put that vow to the test.
It's been extremely difficult, but I don't have any other option to be negative and not be positive for him. It's the worst thing I could ever imagine as a newly married couple.
For 6 years, Jackson thought he just suffered from so-called stomach issues.
I was having just very irregular bowel movements. I was having like diarrhea all the time, like stomach pains and whatnot. And they kind of just passed it off as like GERD and IBS.
But 3 weeks ago, those stomach issues became so unbearable, he took himself to the emergency room.
It got so bad that I'm like, okay, I'm driving to urgent care. So I get to KU urgent care and I was just projectile vomiting everywhere.
Doctors at the University of Kansas Health System ran tests, took Jackson in for surgery. He had no idea what he was about to hear next.
That's whenever I got officially diagnosed with stage 4 colon cancer.
Stage 4 colon cancer that had metastasized to his liver.
I was kind of just like, you know, it'll be okay, it's fine, trying to be strong, didn't really hit me. And it would have been Monday or Tuesday is when I was just like, oh my God, I might die.
Jackson's oncologist immediately put him on an aggressive chemo regimen.
There we go. It's supposed to help with cancer somehow.
In the meantime,
We've got blueberries, strawberries, and then non-fat organic Greek yogurt. Good stuff.
Jackson is doing his part,
It's actually pretty good with the turmeric in there.
feeding his body and soul.
Prayer cards, that's probably been one of the biggest reasons, honestly, that I've been able to be as optimistic and calm as I have been, is definitely faith in God.
At the end of the day, we just keep saying he's not going to be a statistic.
My doctor told me, he's like, you probably will never know how you got this and for how long you've had this. And to me, I hate that. Like, how can I not know how I got stage 4 colon cancer?
We're so glad to have Jackson and Hannah with us here in studio this morning, and we just can't thank you both enough for just being so open and candid, talking with us right now. I know you're undergoing chemo right now as we speak,
Yeah.
so thank you for getting up early and being with us. We also welcome back Dr. John Ashcraft, colorectal surgeon here at the University of Kansas Health System. You recently treated Jackson. I know that we've spoken about this before, talking about this trend in younger adults getting colorectal cancer. We're going to talk to you about it again and see if we can't figure out what's going on. When I told you that Hannah and Jackson wanted to come in and talk about this, you said, clear my schedule, I'm coming in, because you said, we've got to talk about this again.
The message is important.
Yeah.
It's tremendously important.
It really is. So Jackson, you said that you were dealing with GI issues really for years.
Yeah.
I mean, you were 27 when you were diagnosed just a few weeks ago. You've had a birthday since, so you're 28. When we say for years, that means in your early 20s you've been going through this. Tell us about what you were feeling about these symptoms when you were younger.
Yeah, so I really started having a lot of stomach issues of just like diarrhea and acid reflux and other things probably about when I was like 20, 21, 22. And I went and saw my primary care physician at the time and then kind of talked to a GI specialist, and they just were like, you know, it's probably just IBS or it's just an upset stomach. You know, there's not much you can do about it. So they gave me some acid reflux medicine, told me to take like Pepto and Imodium and some things to help, and that was kind of it. And I was just dealing with that for probably 6, 7, 8+ years. And I couldn't figure out what type of food was causing it or what was really causing it. So I was just dealing with that nonstop all the time and just left it at that.
Dr. Ashcraft, I'm thinking, okay, 7, 8 years, that seems a little lengthy, but somebody maybe in their young 20s, I'm kind of thinking about what I was eating in my young 20s, maybe not the best of diets. So would it be not unusual for somebody in their young 20s to be eating stuff and just pass it off as maybe, okay, upset stomach, maybe eating a bunch of junk? When might they go see a doctor?
So that's a great question. So we typically say if your symptoms are lasting longer than a week or two,
okay,
you should probably get that checked out. The problem is exactly what Jackson said. We know that about 75% of patients have already sought medical care. They went to see their primary care doctor. They went to see, urgent care or wherever, but it got passed off as something else. And so we know that about 75% of patients have sought care and seen multiple physicians before they ultimately got diagnosed. And not only is that the issue, but then that lengthens the time for the diagnosis. We know that the vast majority of patients in this age group go more than 6 months before they get diagnosed.
So that's concerning. I mean,
That
here's
is.
a young kid doing the right thing, going to see a doctor.
Yep.
You don't hear about that very often.
Not usually.
No.
So good for you. So what kind of remedies were you doing? Were you taking Pepto and doing these kind of things? Were you changing anything in your diet back then?
So, I mean, I was, eating pretty relatively clean, for what we can eat with what we have as options for food and whatnot. I was eating chicken and rice and broccoli for lunch and ground beef and steak. I wasn't eating a bunch of crap or fast food. And I was eating like a high protein diet. And so it would just be either every day or every other day I would have really abnormal bowel movements or having diarrhea or stomach pain or something along those lines. And so I would just not either take anything or try to take, Tums or something as needed, but that was really about it. I didn't have any other option or any other advice on what to do about it. I was kind of just told deal with it.
Hannah, you were along for the ride during this time, part of these years. What were you noticing and how was this affecting his daily life?
I think a lot of the times I have my personal GI issues. I have IBS. So I think a lot of the times him and I would kind of like compare, and I'd be like, oh, that's normal. That sounds like IBS. And he would have his normal stomach aches. And looking back now, knowing what we know, that was not normal. And I think a lot of people in general, but young people, just kind of surpass stomach aches and stomach pain to be normal. And it's not normal. But yeah, I mean, compared to the average person, he would eat pretty clean. I mean, just rice and ground beef every day. So, yeah.
So, Dr. Ashcraft, we're sitting here with two young people in their 20s with stomach issues. So that brings me to my question that I ask you every time we're on the show. What gives? What's up with this? Why are young people having these issues? And how is it progressing into cancer?
Yeah, I wish I knew the answer. I wish we as a society knew the answer. We've talked about it when I met him in the hospital. We don't know the answer. The reality is there's several hypotheses out there, ones that we're actually investigating here at the University of Kansas, things like the microbiome through Dr. Umar, microplastics, nanoplastics, things like that are some things that we're looking at. Definitely there's a component of bioaccumulation, biomagnification, where these chemicals and pesticides and things like that are being accumulated and magnified through the food chain. There's all kinds of hypotheses out there, but the answer is we don't know. What we do know is this group of patients, this group that was born between like the 60s to 2000-ish, they are called a birth cohort, and that cohort was exposed to something, and we don't know what it is, because that's why we're seeing that uptick. And so we call it a birth cohort effect, but we don't know what the cause is.
So you met Jackson when he came in. You did a surgery on him immediately, and now you have a colostomy?
Yep.
Okay, so how have you been doing with that?
At first, it was tough to get used to. Like, basically, I mean, it all happened so quickly, right? Like, I got diagnosed. Dr. Ashcraft took me in for surgery, gave me a colostomy, took out my tumor, and then, like, I just wake up, and then I've got a bag dangling from my stomach. So it's taken a while to get used to. I wouldn't say I'm necessarily fully used to it yet, but I've been adapting.
You've only had a few weeks to get kind of your head around all of this.
Right.
And then you just started aggressive chemotherapy. at how's that been going? I mean, you just started this last week.
Yeah. Last week was kind of my first round. Didn't hit too hard, which I'm thankful. Just some kind of minor weird side effects to start with. But I'm actually starting a new chemotherapy next week with a new drug that's supposed to target my specific BRAF mutation, which is super interesting, and I'm excited to start getting that done. But luckily, it hasn't been too bad as of yet. I hear it gets worse and worse as you go, but just trying to stay optimistic and stay positive through it.
Dr. Ashcraft, I rarely hear people say I'm really excited to get going on that when it comes to chemo. And I have to tell you, when I was driving out to their house, thank you for letting us come out and spend some time with you at your home, but I didn't know what to make of going out to someone's home. Here's a young couple, they're newly married, and just really devastating diagnosis. And these two welcome us in, and they're just you're just energetic and lots of spirit and just ready to face this head on. And I didn't know what to make of it. And they were just so just ready to get after it. I mean, what do you make of this, of Jackson and his will to get after this and get the word out and really make this mean something to others?
No, Jackson's got the right mentality 100%, and they both have throughout this, ever since I met them, which is, we know what we're dealing with. We're going to attack this head on. Let's get started. They were super eager to get started. We actually started them a little earlier than we normally do, but it was everything we could to get them started on treatment, and so we were aggressive and pushed hard. The fact that they're here, getting this message out, is incredibly important, not just for Jackson, but for Hannah too, because it's not just Jackson going through it, it's Hannah going through it as well. Much like those prayer cards I'm sure have said, is, it's both of you undergoing this treatment. And so she has been greatly supportive. She was there every day in the hospital and had really a lot of great questions as she went through. So
yeah, not a lot of tears. And you said I don't spend a lot of time crying. You actually you substitute that for a lot of research. I know that you do in your spare time. You're up late researching and trying to find answers. You really focus on staying strong for your husband.
Yeah, I think if I were in his position, I wouldn't want people around me crying all the time, seeing that negative side. Obviously, we both have our times where we're emotional and we cry together. So I'm not saying that I don't cry. I cry a lot. But I try to focus my energy in other places, in places where I know that I can do something. And I think the biggest thing in this is both of us, we have to be his biggest advocate during all these appointments and, asking all the right questions, because sometimes a lot of things are surpassed and people think that we don't know what we're talking about. And so I feel like researching and learning more about the disease is what kind of helps me understand a little bit more and kind of help him understand as well.
She's been incredible. I mean, she's been on webinars about different types of clinical trials and liver surgeries and all these different types of things. And I haven't really had the time or the drive to do it. I've just been trying to work as I can and do little bits of research here and there. But she's working late, just doing as much research as possible, and it's incredible. And she's been so strong for me. I mean, like you mentioned, I didn't see her really cry once in the hospital when I was in there for a week straight, and she was sleeping on a couch next to me for 7 straight days. She deserves all the credit in the world for going through this with me, and she's been amazing.
Well, and you're both doing what you can, and that includes eating healthy foods, getting in the kitchen. We saw you, mixing up good stuff. Your Greek yogurt and your bone broth and your tea, and what kind of things are you adding to your diet or taking out of your diet right now?
Yeah, so a lot of it has been thanks to my brother and Hannah, just kind of researching and other dietitian guidelines kind of on with the bag itself and going through the cancer and everything. But just trying to keep things as clean as possible, avoiding anything with as additives and preservatives in there, trying to avoid sugar as much as possible unless it's natural. Just trying to avoid red meat as well, and things that are kind of hard to digest. So it's a little bit of slim pickings sometimes in terms of the meat options I get with a lot of chicken and turkey. But basically, just trying to keep everything as clean as possible and as holistic and natural as possible. We're not trying to avoid gluten as well and whatnot, but it's definitely a big change. I was eating clean before, but this kind of takes it to a whole new level. But I think it's important, and I think a lot of people should look at what they're eating and really reading those labels, because it's crazy the amount of stuff that's added to our food, and the preservatives and the colors and dyes and everything. Like, you never really think about it, but it can be difficult to find some food that doesn't have all that stuff added to it, and that's the stuff that I'm trying to avoid, and I think a lot of people need to look at and try to avoid as well.
Yeah, I know you're very, very passionate about getting the word out about what we put in our bodies. And I know Dr. Ashcraft is like shaking his head. It must be really refreshing to know that when you have a patient goes home and actually, puts to action, you're sending them home to say, hey, I can only take you so far. You got to go home and really do your part to do right by your own body and soul, because I know you both really get up and you look at those prayer cards that are on your refrigerator and really take it to heart and are there for each other. Tell us how much that means to you.
It means a lot. We wake up every morning and we've kind of got like a daily devotional and scripture thing that we read some verses in the morning. And then, obviously the prayer cards and everything, but it's just the entire time. And I really struggled kind of a couple days after the diagnosis mentally, like my life. The week before I was out duck hunting with friends. Like, I didn't think this was going to happen to me. And my life just complete 180, in terms of what's going on. So I really struggled for a bit, but being able to use faith and Hannah and my family and friends has really been able to keep me positive, not be as anxious, and really turn this into, like Dr. Ashcraft said, I'm going to go attack it. I'm not going to be a statistic. We're going to try to beat this, get clear, and be able to just talk about this with other people. There's so many people I talk to and I know that have stomach issues that are in their 20s or 30s. I'm not saying, obviously they probably or may not have colon cancer, but I want people to be aware of the signs and symptoms and what they're putting in their bodies, so nobody that's 27, 28 years old has to go through this like I'm going through. Like, I just don't think that should be happening. Like you said, it should be like an older person's disease, and now it's what, the number 1 or number 2 cancer in young adults. It's just crazy to me, and I feel like it's my mission now and a true calling to be able to bring awareness to this and just get the word out about what to look for. And I've had multiple messages through social media of people I've never met before, just across the country, that have been like, I've seen your story, and it made me go reach out to my doctor about getting a colonoscopy. I've had stomach issues, and that to me is like the biggest thing. Like, it makes me feel so good and so rewarding that I'm able to reach people and people to take control, of their health and go get checked out and make sure that they don't have to go through this. So it's very rewarding, and that's what I feel like my calling and kind of mission is while going through this.
Great work. You're just getting started.
Yes, absolutely.
Good stuff. All right, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is on your screen. All right, so Dr. Ashcraft, back to the question. So let's talk about insurance, because they lowered the coverage age to get a colonoscopy, to 45?
Yes, ma'am.
Well, that's not helpful when we have 20s and 30s and people in their young 40s. So can you request a colonoscopy out of pocket? Is this a thing?
So like in Jackson's case, if he would have came in, we would have said his symptoms deserve a colonoscopy. I think all of our GI docs would have agreed with that. The interesting thing to think about it, we have to remember, that changes it from a screening colonoscopy, which is usually completely covered by insurance companies and is part of routine medical care, to a diagnostic colonoscopy, which is not covered and then goes into your deductible and your copays and all that stuff.
Okay.
So it becomes a little bit tricky. To be able to say I'm going to walk into my doctor's office and ask for colonoscopy is a little tad bit unusual, but not unheard of. I think being an advocate for yourself, saying, hey, I've had these symptoms for so long, I really am kind of concerned. We need to look into this further. Plus, this message is now kind of getting out to the primary care doctors, getting out to the internal medicine family practice doctors who see patients like this on a daily basis. And I think we're seeing that shift of a lot more endoscopies and a lot more colonoscopies.
So let's talk Cologuard.
Yeah.
Drugstore testing. How effective is it? What is it testing for? Is this something people in their 20s and 30s should just go for safe measure? Tell us more about this.
So usually you have to have a prescription for it. You have to still go to your doctor and get a prescription for it. It tests for the actual DNA of the tumors. We know that most tumors have a set of genetic malformations that occur. it's never just usually one, it's a collection of multiple genetic defects. And so those defects add up. The DNA stool studies test for those genetic defects. And then if you have them, then you got to get a colonoscopy.
So how is colorectal cancer diagnosed?
Typically it's most commonly diagnosed through colonoscopy, but it can be diagnosed through imaging, which would actually be the way that Jackson's was more accurately seen. When he came in, he was having abdominal pain, distension, he was throwing up like crazy, and so they did a CT scan on him, and we saw the mass in his colon plus the masses in his liver, and that led to the diagnosis.
All right, I want to get to some questions from our viewers this morning. Jill wants to know, did doctors ever do a colonoscopy when giving a diagnosis of IBS? Would his cancer have been diagnosed earlier with a colonoscopy?
Does every patient with IBS get a colonoscopy? No.
Okay.
Should they? I think you got to look at the symptoms and look at kind of the global picture. I think that the ability to get a colonoscopy and the indications for getting a colonoscopy are becoming a lot more lax now. Patients are getting them a lot more frequently, but you got to make that step to get in to see the doctor. As I said before, the significant vast majority of patients at Jackson's age have seen 2 or 3 doctors before they get diagnosed, and that delays their diagnosis for months. And then the second question was, would a colonoscopy have caught this quicker? Well, by definition, yes. We do colonoscopies not to find cancer. We do colonoscopies to find the polyps. We want to get the polyps out because we know if the polyps stay in there, they will become a cancer. And so the trick is to do the colonoscopy before cancer even shows up. That's the purpose. But unfortunately, we do them many times and we find the cancer.
Sarah has 2 questions. Is colorectal cancer considered aggressive, an aggressive cancer? That's
a great question, and it's a frustrating question. Everybody's cancer is different. The genetics of Jackson's tumor are different than the genetics of my patient I'm about to operate on. Everybody's genetics are different, which then goes into how rapidly it grows, how quickly it wants to metastasize, things of that nature. And so overall, every tumor is different. Some are slow growing, some are fast growing. We just have to see how they respond.
So is it hereditary?
There is. We know that the vast majority of colon cancers are sporadic and that we don't have a cause. About 25 to 30% have a genetic cause and a familial component.
Do you know if it runs in your family?
Not yet. We haven't been able to do the genetic. I don't think we've got the genetic testing back for that yet. So I'm not entirely sure, but from just my own knowledge of family history, no. The only thing I do know that runs in the family is breast cancer, but not colon cancer.
Dr. Ashcraft, what's the big takeaway from this conversation? Because we will have these, continue to follow this story, but as this conversation ends today, what do you want people to really take away?
If you have bleeding, if you have change in bowel habits that last more than a week or 2, if you have any concerning symptoms, weight loss that you can't explain, anything like that, go advocate for yourself. Seek your doctor, advocate for yourself. If you really are that concerned, push for the colonoscopy and get it.
Hannah, from the standpoint of a spouse, a partner, what do you want people to take away?
Well, I was going to say what Dr. Ashcraft said, but advocate for yourself, advocate for your partner, track your symptoms, watch what you eat, and just, continue to advocate for yourself is the biggest one.
Yeah, and Jackson's story is a great one because if you remember, he said he changed his diet several times, but it didn't really help. And so that would be a big clue that something else was amiss. If it was really diet related, then changing his diet really should have helped a lot.
Sure.
But the fact that it didn't should have clued us in a little sooner.
Good point, good point.
Yeah.
Jackson, what's the big takeaway from your story?
It's same thing as everything, or as kind of what everybody said. When I originally had some symptoms dating back some months, I had the bowel movements. I did, without really realizing it, have blood in my stool. And I was looking at it and I just kind of passed it off. It wasn't, bright red blood. It was darker, so I thought it was what I was eating. And I was having stomach pain. I was feeling more fatigued than usual and lethargic. I was looking more pale. So all these things, I passed it off as stress from work or from buying a house and moving. And really, I should have been more aware of it, and that's on me. And I just want people, like everybody's been saying, know your body, know if something's wrong, go get checked. It's not like you should be paranoid, it's instant colon cancer, but at least go get checked, try to push for a colonoscopy or at least something just to make sure. just whatever I can do to help share the message so nobody else has to go through this, or at least catch it early. Like, what if I was able to get a colonoscopy 7 years ago? Would I still have stage 4 colon cancer? Maybe, maybe not. Like, I don't know. It could have been caught earlier. Who knows? So I just want people to be able to catch it early if they have something wrong, and really, like they said, advocate for themselves.
Thank you for using our this platform to share your story.
Yeah.
Thank you so much. Thanks to all of our guests today, and thanks to our viewers for being with us. We'll see you back here tomorrow. Instead of testing your memory to check for Alzheimer's, now you can test your blood. But are doctors ready for what comes next? I'm Jessica Lovell on the next Open Mics with Dr. Stites, how the new Alzheimer's blood tests work and when it makes sense to ask for one, and what happens if it comes back positive. Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.